Massage is a systematic manipulation of the soft tissues of the body. The four movements are effleurage, petrissage, friction, and tapotement.
Tapotement. Before making physical contact, you need to properly position the patient. For a back massage, place them comfortably in a prone position, lying flat on their stomach. Next, apply a small amount of massage lotion or oil to your hands. This creates a barrier that reduces surface friction against the patient's skin.
Let us understand the correct steps. Effleurage, stroking. Effleurage is a gentle, smooth, gliding movement performed mainly with the palm.
Place both hands flat on the lower back and glide upward directly toward the shoulders. At the upper back, move laterally over the shoulders, following an unbroken line down the sides to return to the starting position. A common error is lifting your hands off the patient during the return stroke. You must maintain continuous, smooth contact with the skin throughout the entire loop. Keep your downward pressure light and comfortable. This is especially important during the first few passes as the patient acclimates to your touch. Repeating this unbroken loop rhythmically builds physical trust and signals the nervous system to relax, preparing the tissue for deeper work.
Petrissage is a kneading movement in which the soft tissues are gently lifted, compressed, and released.
Called Petrissage, which uses a rhythmic kneading motion. Grasp a small amount of soft tissue, lift it slightly away from the bone, gently compress, knead, and release before moving to the adjacent area. This lifting motion must be controlled. Excessive force or aggressive squeezing can cause bruising, which contradicts the goal of relaxing the muscle. After addressing broad muscle groups with Petrissage, we shift to friction. This technique moves from broad kneading to pinpoint, localized targeting. Using your fingertips or thumbs, apply controlled pressure in small circular, transverse, or longitudinal patterns. Keep your fingers anchored to one localized spot rather than gliding over the skin. When completing a friction movement, release your pressure gradually. This helps prevent skin irritation in the localized area. Combining the broad muscle lifting of Petrissage with the pinpoint rubbing of friction allows you to resolve both general tension and specific focal tightness. The final movement is tapotement. These are rhythmic, percussive strikes, generally performed for shorter durations than the previous techniques. For the hacking technique, keep your hands and fingers relaxed and strike the muscle using the ulnar borders, the outer pinky side edge of your hands. For cupping, form your hands into a hollow cup shape and gently strike the surface to create a muffled percussive impact. For tapping, use relaxed fingertips to deliver very light, rapid taps across the muscular area. Because these are percussive impacts, you must avoid the spine and kidneys. Never use excessive force, as the movement should remain rhythmic and controlled. When applied correctly, Tapotement invigorates the area and improves local circulation without reversing the relaxation achieved in the earlier steps. To remember these terms, pair them with their primary actions. Effleurage means to glide, Petrissage means to knead, friction means to rub, and Tapotement means to percuss. Throughout the protocol, your primary responsibility is to continuously monitor the patient's comfort and adhere to your institution's nursing guidelines. Completing these movements in a systematic sequence ensures that the soft tissue manipulation remains focused, safe, and clinically effective.